This is the one which is one. Next slide. Good afternoon, everyone. Thank you, Dr. Vitull and the organizing committee for inviting me. It's a beautifully organized conference, extremely professional. I'll not take much time. I'll proceed with my presentation and then we'll see. So sleep disorders, types, subtypes, cause and management. I've tried to show here a beautiful painting by a Russian painter, Victor. It's a world-class painting. It's an old proverb, a good laugh and a long sleep are the best cures in doctor's book. How to define a sleep? Sleep is a state of reversible behavior in which there's a perceptual disengagement and unresponsiveness to one's environment. It is also defined as a period of rest for the body and mind during which volition and consciousness are in partial or complete abeyance and the body functions are partially paralyzed. Sleep is important to a number of brain functions, including how nerve cells communicate with each other. Humans normally sleep in supine position with eyes closed. Now, unusual phenomena could be sleepwalking or sleep talking. A very burning question comes up, is sleep an active or a passive process? Normally, everybody thinks it's a passive, but the surprising part is that it is not a passive process, but an active one. In fact, the brain and the body stay remarkably active while sleeping. It is supported by PET scan and functional MRI. The red areas denote state of higher activity, which we can see in the REM sleep, which is the rapid eye movement sleep, a deep sleep. Why do we sleep? What is the need for sleeping? Normally, 1/3 of the human life is spent in sleep. There are different theories which I'm put forward. The first one is protective behavior adaptation. Energy conservation is the second one. Hormone regulation. Fourth one is memory consolidation, creativity, and brain restoration. Fifth one, immune function regulation with the role of natural killer cells. And the last is emotional balance and mood. I'll take briefly one by one. I'll not take much time for this. The protective behavior adaptation, it was thought that during 24 hours, the species and the animals need to protect themselves, hence they sleep, but didn't hold true for all species. Energy conservation, it was postulated that in order to survive, body needs rest to conserve energy, but this theory has its own limitations. Various hormones have been associated with the sleep, namely melatonin, cortisol, growth hormone, and thyrotropin. They play a big role. Other associated hormones are acetylcholine, 5-hydroxytryptamine, norepinephrine, gamma-aminobutyric acid, orexin, and serotonin. Hormone regulation during sleep, I'll highlight few hormones. That melatonin production will start before the sleep and peaks at midnight. The cortisol levels are pretty low at night, but they peak early in the morning. Thyrotropin and growth hormone, both of them peak at night, and the cerebral blood flow is at a height, its peak during the midnight. Now, memory consolidation and creativity, whenever we receive some information, it is stored in the brain in a specific formulation. There's an encoding, followed by storing, leading to imprinting, and then for last is recall. Sleep plays a housekeeping role. It removes toxins and metabolic waste, just like immunoglobulins, proteins like beta amyloid and protein fragments from the interstitium, while lymphatic system in the brain, which build up during awake state and settles memory. It is the beta amyloid non-clearance and its deposition which is a risk factor for Alzheimer's. Number of studies are being carried out on this beta amyloid non-clearance. Immune function regulation, it gets activated during night, especially there's increased production of natural killer cells, which are WBCs, which destroy infected and diseased cells, thereby destroy the cancer cells. Last is emotional balance and mood. Amygdala, which is next to hippocampus. The main function of amygdala are emotional responses like happiness, fear, anger, or anxiety. It is a sleep deprivation which leads to excitation of amygdala and which further leads to phases of irritability, anger, and mood fluctuations. Amygdala excitation is one of the precursors for the substance abuse, and in contrast, frontal precortex exerts suppressant effect on amygdala. Sleep plays an important role in maintaining a normal homeostasis of the body. Another painting by a Spanish painter, Antonio de Preda in 1655, the Night Dream, quite a famous painting. I'll just touch a few lines with the anatomy part. It is a suprachiasmatic nucleus which is situated in the anterior part of the hypothalamus. It is the central pacemaker of the circadian rhythm. The efferent tract is the retinohypothalamic tract, and the efferent tract starts from the pineal gland, which further secretes melatonin. Try to show over here the retinal ganglion cells with the light, how it affects the system. We have the retinohypothalamic tract is there, the pineal gland secreting melatonin, which play a role during the night, during the sleep part. The physiology of the sleep is, when there is a dark room, which stimulates the suprachiasmatic nucleus. There is a release of norepinephrine, which irritates the pineal gland. There is a release of melatonin. That initiates the circadian rhythm, which further leads to release of prolactin, ACTH, norepinephrine. Melatonin further secreted, and this cycle is repeated. Just like what starts the circadian is the melatonin, and what starts the sleep cycle is the dark room. Normal awake sleep cycle, we have two factors basically, homeostatic factor and the circadian factor. Homeostatic factor stands for, or also known as factor S. It is dependent on the number of awake hours prior to sleep, and whenever we remain awake, there is accumulation of adenosine. And circadian factor or biological factor or factor C, it is maintained by the suprachiasmatic nucleus. Now there is a balance between factor S and factor C, which I've tried to show over here. Another slide is there showing the process C and the process S, how we remain awake and how we start sleeping. Polysomnography, EEG, electrooculography, electromyography help in collecting different waves from the brain like alpha, beta, theta, gamma, delta, leading to differentiation of the sleep stages. Sleep is divided into two phases, non-REM and REM. Non-REM stands for non-rapid eye movement, and REM is rapid eye movement. Non-REM is stage 1, 2, 3, 4, but lately stage 3 and 4 are collectively known as slow wave sleeps, and we have tried to combine them also. And REM sleeps for rapid eye movement. Now try to show over here that the normal sleep, the NREM constitutes 75 to 80% of the sleep, and the REM or the deep sleep is the dreaming sleep constitutes only for the 20 to 25%. To start with, there is a stage 1 when the body starts relaxing. Stage 2, the brain slows down further. That is the maximum part of the sleep a person is 45 to 55%. Stage 3 and 4 collectively known as where body and tissue restoration takes place. It's a deep restorative sleep. And the last is rapid eye movement, where the learning and memory consolidation takes place. We call it also a dreaming sleep. Now, waves during sleep. During the awake state, I've tried to formulate a small graph over here. You can see that in the awake, when the eyes are open, there are beta waves. I've written B to start with. And when in the awake state, when the eyes are closed, is the alpha waves come up. And NREM, in the N1 stage, the first stage, the theta waves are there, which are so-called positive sharp transients. N2 spindles, in the N2 stage, there are sleep spindles or K complexes. Often we have teeth grinding or bruxism seen in children. Now N3 sleep stage has got delta waves basically, which are low frequency, high amplitude, sleepwalking, night terrors, and bedwetting. Another thing, for the bedwetting, we often use imipramine in children, and the basis behind it that it decreases the stage 3, thereby leads to improvement in the bedwetting. Regarding the rapid eye movement sleep, there are beta waves. Dreaming and memory processing takes place. One remembers dream. The waves are sawtooth appearance. Muscles are paralyzed except extraorbital and breathing muscles. Now, word about latency. What is latency? It means that how long. Now, sleep latency is the time taken to fall asleep, and there's a word which I'll use in diseases further, the REM latency. It's the time taken to get to REM sleep. Now, I've taken to start with just one disease, like a depression, in which the sleep latency is increased, the REM latency is decreased, the N3 or the delta waves are there, which are decreased, and the REM density is increased. It is the first REM phase which is increased. And when we use SSRIs or antidepressants, we try to suppress the REM sleep. Conditions with increased REM latency are restless leg syndrome, older adults, and conditions with decreased REM latency are depression and narcolepsy. Slow wave sleep, considered as most restorative sleep, occurs in first half of the sleep, and 20% of the sleep time is spent in this stage. There's an increased vagal tone with decreased sympathetic activity, leads to decreased heart rate, blood pressure, and cardiac workload. Now, one sleep cycle is consisting of one NREM and one REM, and average time taken with one sleep cycle is 90 minutes. For a normal individual, we have 4 to 5 such sleep cycles in a night. In the initial part of the sleep, you can see that there is a slow wave preponderance. One often lands to stage 3 and stage 4, and as the night progresses, in the later part, the REM sleep preponderance becomes much more. Again, I've tried to show a hypnogram over here. The initial part of the night, slow wave preponderance is there, shown in the red color, and the later part of the night, REM sleep preponderance is there, which is shown in the blue color. Slide of a polysomnogram. Stage 1 showing slowing of the activities of the brain waves. In the stage 2, we have K complexes. REM sleep, a typical pattern is shown over here. I'll not go into details about all the physiological changes which take place in the awake state, the REM and NREM, for the heart rate, blood pressure, cardiac output, respirate. It will take a lot of time because we are short of time at the moment. Now, a few words about the wake control mechanism and how it works. The accessory pathway is in the form of reticle formation, which goes to thalamus and cortex. The neurotransmitters involved are norepinephrine, 5-hydroxytryptamine, dopamine, orexin, and hypocretin, which is a neuropeptide secreted by the hypothalamus, plays a big role. It helps in regulating arousal and wakefulness. Orexin also has a big role in the appetite part also. And lack of orexin leads to narcolepsy and obesity. I'll just a brief word about what is NREM sleep. It originates at the ventrolateral preoptic area, surpasses the activity of the wake-promoting substances, thereby initiates NREM sleep. And for REM sleep, it originates at the lateral and post-pontine neurons, cholinergic in nature, exert inhibitory neurons to spinal motor neurons to produce REM atonia. Now, I've tried to show over here the wake-promoting substances and the sleep-promoting substances. On one side, we have adenosine, GABA, ghrelin, and melatonin, and on the other side, we have norepinephrine, histamine, serotonin, and hypocretin. It all depends which way. If the wake-promoting substances are on a higher side, one gets awake. If the sleep-promoting hormones are on a higher side, one tends to go to sleep. Same way, it's a sleep-wake switch. Acetylcholine, histamine, 5-hydroxytryptamine, orexin, norepinephrine on one side, and I've tried to show the other part on the other side. Decreased REM is associated with synucleins, a protein associated with synapses in the brain, and often seen with patients with Lewy bodies. Sleep duration 14 to 15 hours for an infant, and well, it keeps on decreasing, and the elderly go by only 6 to 7 hours. Now, criteria of a normal sleep is dependent on quality, quantity, and timing of the sleep. The International Classification, or ICSD 2014, is based on pathophysiology and the symptoms. We tried to classify into the following one. First is insomnia, second is sleep-related breathing disorders, hypersomnias, circadian sleep disorders, parasomnias, sleep-related movement disorders, isolate symptoms. Just few points about it. Insomnia, which is a lack of sleep, leads to exhaustion, drowsiness, anxiety, depression, cardiac and metabolic problems. It has two types, chronic and short term. Chronic is more than 3 months, 3 times a week, and short term is less than 3 months. Clinical features are inability to initiate sleep with good congenial environment. Most common disorder seen in 10% of the population, which gets up early, the patient gets up early, associated with headaches, body aches, and mood changes, leads to anger, irritability. One should follow a heart-healthy style. Make your bedroom sleep-friendly. Avoid caffeine, nicotine, and alcohol. Avoid afternoon naps. Go to sleep and wake up around the same time. Have a good physical activity like yoga. Eat meals on regular schedule and try to learn meditation. They all help in insomnia. Medications for insomnia should be used at the last when other factors are not working. We have benzodiazepines, benzodiazepine receptor agonists, melatonin receptor agonists, orexin receptor agonists, and tricyclic antidepressants. It all depends on the clinical condition of the patient. Sleep-related breathing disorders, and during sleep, the gravity and muscle relaxation allow the tongue and the surrounding soft tissue to fall back into the throat, obstructing the airflow. I've tried to show over here obstructive sleep apnea, which is of two types, adult and pediatric. Then there's another entity called central sleep apnea syndrome. Third is sleep-related hypoventilation disorders and sleep-related hypoxemia disorders. Just a wave pattern which we observe in the polysomnography. What is the obstructive apnea, mixed, and central apnea, how we differentiate them. Now, criteria for obstructive sleep apnea is one has normally it's an obese, large-sized neck, complains of sleepiness during the daytime, and non-restorative sleep, fatigue, and insomnia symptoms are there. Patient wakes up with a breath holding or gasping or choking. Bed partner reports there's a loud snoring, interruptions in the breathing, or both. Patient is often diagnosed with hypertension, cognitive dysfunction, mood disorders, coronary artery disease, CVAs, CHF, diabetes, and atrial fibrillation. Treatment lies with basically lifestyle changes. One should advocate loss of weight with exercise, quit smoking, alcohol. Nasal decongestants should be used, and avoid anti-anxiety or sleeping pills. Therapies like cognitive behavior therapy and biofeedback, CPAP and BiPAP play a big role over here. Hypersomnia is excessive sleep. We call it as narcolepsy. Ability to regulate or sleep-wake cycle is impaired. I'll be short, just don't. Frequent lapses into sleep and the elements of the sleep while awake. Hypersomnia is narcolepsy type 1, type 2, idiopathic, Kleene-Levin syndrome, hypersomnia due to medical and psychiatric disorders, hypersomnia due to medication or substance abuse, lack of wake-promoting substances, and inefficient sleep syndrome. Now, narcolepsy is daytime sleepiness, catalepsy, hypnagogic hallucinations, and sleep paralysis. A few words about catalepsy is a loss of muscle tone. The treatment is gamma hydroxybutyrate, also known as a date rape drug. Salt is sodium oxidate. Person taking this drug when mixed with alcohol goes to sleep, and the mechanism of action is it works through GABA B, whereas benzodiazepines work through GABA A. Modafinil is used to keep the person awake, and narcolepsy is associated with hypocretin system, and orexin is deficient. Circadian rhythm, there's a delayed sleep-wake disorder. One sleeps at 4 a.m. and gets up after a normal sleep, with a normal sleep of 7 to 8 hours. Advanced sleep-wake disorder seen in elderly patients, they sleep early and get up at the midnight. Irregular sleep-wake rhythm disorders, shift worker disorders seen in shift worker disorders, and jet lag disorders. Chronotherapy aims to restore proper circadian rhythm of sleep-wake cycle through adequate hygiene, timed light exposure, and use of chronobiotic medications like melatonin. Parasomnias, which is abnormal behavior during sleep, sleepwalking, or sleep talking. Types NREM and REM related parasomnias. Few differentiations between NREM and REM related parasomnias. Now, the last is sleep related movement disorders, where we have restless leg syndrome, periodic limb movement disorders, sleep related leg cramps or bruxism, benign sleep myoclonus, propriospinal myoclonus, and sleep related movement disorders. I'll take restless syndrome only. An urge to move legs accompanied by or thought caused by uncomfortable and unpleasantness sensation in the legs. They begin or worsen during the periods of rest, such as lying down or sitting, relieved by walking or stretching the limbs, or as long as the physical activity continues. Must check the serum iron levels, which are extremely low in patients with restless leg syndrome. Treatments, medical treatment lies with gabapentin, pregabalin, ropinirole, and few other mentioned drugs over here. Few sleep facts. The longest someone has gone to sleep is 11 days, 25 minutes. Two lines about Kumbhakaran, that the man who used to sleep for 300 days, brother of king of Lanka, Ravan, a devotee of Lord Brahma, he suffered from hypothalamic syndrome, clean levine syndrome. There's a bilateral ventromedial nucleus involvement and characterized by periodic episodic somnolence. There's hyperphagia along with other behavioral and cognitive difficulties. I'll not touch these different species. Dolphins sleep in the upright position with one hemisphere. It is just a few lines about what is somnophobia. It's a fear of falling asleep. Onirophobia is fear of nightmares or dreams. Clinomania is irresistible urge to stay cozy in the bed, while dysania is feeling when woken, don't want to get out of the bed. Sleep hygiene is bright screens like TV, video games, phones, and laptops should be avoided. Avoid alcohol intake 4 to 6 hours before going to bed. Avoid caffeine, nicotine. Avoid excessive exercise before going to bed. Thank you so much. Any questions from the audience? Thank you.
Thank you, sir, for this informative presentation.